Well, you know, the year is winding down, and it's actually the perfect time to reevaluate your health and make sure that you're taking care of your body.
So Dr. Ameeth Vedre is the director of echocardiography and nuclear cardiology at First Coast Cardiovascular Institute. He treats and helps people and prevent cardiovascular problems. Thank you so much for being here.
Thank you for
So
having me.
I'm just impressed that I got through all three of those words.
That was.
Can we
That
all go?
was quite the alliteration for you.
Yes, it was. It was like you getting back at me. Okay, so first of all, for us laymen's and for layman's terms, can you just describe what echocardiography is and put it into words we can understand?
Sure, thank you for having me. Echocardiography is a diagnostic modality in cardiology which essentially identifies through sound waves. It's pretty much like ultrasound and goes through identification of heart valve, chambers, and the size and dimensions. Hugely important in evaluation of heart murmurs, hypertension, identification of even stroke and heart disease. So, yeah.
With all of that, why is it so important then for patients if they're going to choose doctors and facilities to have these kinds of tests, that they choose those doctors and facilities that are accredited? Why the accreditation?
Sure.
Why is it so important?
Thank you. Yeah, so essentially Intersocietal Accreditation Commission, and we are very proud to have associated with that, is it defines higher standard of care. And we go through a very rigorous application process, and it's very important to know and get quality care. And it's almost very equal to standard of care like Cleveland Clinic or Mayo Clinics, and we are very proud to have it in Jacksonville.
Yeah, and let's talk about prevention being just so important when it comes to cardiovascular health, and that's kind of step one. Why is that so imperative?
Essentially, we need to know, this day and age, the goal of preventive cardiology is important in identification of lowering heart disease. So if you know what you're dealing with and trying to identify and educate and treat the patient, we will be able to treat them better.
And speaking of that, so what are some of the different types of prevention treatment concerns?
Sure. In addition to modification of risk factors, identification of primary prevention risk factors like hypertension, smoking, and identification of those risk factors, and trying to see who needs medications ideally. So the American Heart Association has come about with newer guidelines in identifying who needs statins and the intensity of statins. So that's what we'll talk about more.
Oh yeah, and so how do we lower our risk, I guess, if a lot of people are watching right now and they want to know what can we be doing to lower our risk for heart disease?
Sure.
What are some ideas and things that people should be thinking about?
In addition to exercise regimens, we all talk about going through phenomenal information, and nowadays all of them go through online. So the National Heart Lung Institutes and AHA institutes have, and choosemyplate.gov, all these websites have a huge wealth of information which can be utilized in identification of the accurate amount of saturated fat, high protein, low carb diet, exercise regimens, staying off tobacco products. All these are very important.
Now you have all of the high-tech testing at your fingertips. So what diagnostic testing is useful in diagnosing heart disease?
Essentially, it would be primarily basic standards like stress tests, and among the wealth of information we have is stress tests and echocardiography. These are very basic to identify that. So exercise and pharmacological tests, they help us, doctors, to identify and treat the severity of heart disease, risk stratify them correctly, and give them accurate analogy of where to go from there. Yeah.
And let's go a little bit more in depth with stress testing. We saw a picture of a gentleman on the treadmill. What
Sure.
is and goes into stress testing?
So when the exercise treadmill is going along, they are hooked up to the EKG and the blood pressure parameters. Doctors and technicians are along with there and identifying the blood pressure parameters and trying to see when the heart is working harder, and if there is any narrowing of a blood vessel, we do have different parameters in identifying the lower in blood pressure, higher in blood pressure, or EKG parameters, and educating them and treating them on who needs further testing or more testing is important.
And that's what you're looking for. So if you're the person going through this stress testing,
Right.
what should you be expecting?
You can expect yourself to, it's a little different from your regular YMC, I believe, but at the same time, the inclination and the speed are slightly different in a 3-minute or 2-minute protocol, and we will be guiding you through to identify and go through the different tests and identify the blood pressure and make it an easier process like that.
And ultimately, what do those results then show?
They show if the blood vessel is getting blocked, we do have immediate identification with the EKG parameters, the depressions or elevations, and the symptom analogy. This is important in identification of heart disease.
All right. Dr. Vedre, thank you so much for being here, sir. We appreciate your time and your perspective and your valuable advice. And thanks so much to First Coast Cardiovascular Institute for coming on and sponsoring this segment. Remember to know your body, know your risk factors, and work with your doctors to address them.
And if you'd like more information about heart disease from First Coast Cardiovascular Institute, visit cardio.com or call 904-493-3333. It's right there on your screen.